Granger says people are putting AA batteries and even propane tanks out in the garbage. Mechanics say if you want to use less gas, you need to start by taking care of your engine. Many people I talked with today say that they would like to see the Big Red name stay here on the Sexton campus, but they understand why the district is moving away from the nickname. One of those homicides happened right downtown where Lansing will be shooting off fireworks tomorrow night. This race was already one of the largest in Michigan's history, and MSU political scientist Matt Grossman isn't sure if Kelly's charges will help him come out on top. Right now, the Lansing School District has more than 100 positions posted on its website, but it's not for just teachers. Happening right now, Lansing police are trying to figure out if a string of attempted armed robberies are connected. But that's going to change soon. You can see these stacks and stacks of concrete barriers waiting to be put in the southbound lane. The remaining road repairs are extensive and could take years to fully recover. Glad we don't have any flooding like that. It's good here this weekend, but could see some rain.
Yeah, we could see some tomorrow, Cody.
Yeah, the city says that this house on Kavanaugh was not registered as a rental property with the city of Lansing. The city says that's required so it knows which properties need inspected often. And I found no record of this house ever getting that inspection.
You know, we want people to be living in a quality environment and a safe environment.
The city of Lansing inspects rental properties every 2 to 3 years.
Typically we find a number of safety issues. It's not unusual. We notify the owner. We expect those to be corrected.
But the owner of 204 Kavanaugh didn't pay the $640 to register the house with the city. And because of that, it wasn't inspected. And an inspection would have found the house didn't have working smoke detectors.
This is, I think, an underscore of why for rental housing we get in. We are trained to notify the landlord of these type situations. We expect people to fix them because these, quite frankly, are life and death matters.
The head of Lansing's planning department says most landlords in the city are following the law, but there are some that fall through the cracks.
We do have staff that are able to identify these. We're not able to get all of them.
The Lansing Housing Commission says the deadly fire highlights the country's housing problems.
We don't have enough high-quality housing available for people, and so some people are making choices to live in substandard housing because it's the only option that they have.
He says it's unfortunate that people can't trust their landlords to follow their law.
Everybody needs to make sure that they do their own due diligence for their own family. If your landlord's not going to do it, you need to do it. You can check the city's inspections on rental properties for yourself on the city's website. We have a link to that on WILX.com. If you can't find your rental property on that list, you should contact the city. Sparrow Hospital is spending more than $200 an hour for each traveling nurse to help cover shifts. That's a dramatic jump from the $75 an hour it was paying before the pandemic. And it's not just Sparrow seeing this jump. Hospitals across the country are, and now Congress is asking the White House to investigate.
You cannot see the amount of death that we have and just be okay holding it all inside.
Lydia Mobley is a traveling nurse from Michigan. She's one of the thousands of nurses helping hospitals fight the COVID pandemic.
All the time we get patients who, right up until they're admitted to the hospital that COVID wasn't real, or they didn't think it would affect them. And now they're in the ICU and, very near to death.
But those traveling nurses come at a price.
Yes, the volume is higher, but the cost per volume is extraordinary.
More than 600 nurses quit their job at Sparrow Hospital since the pandemic began more than 700 days ago. Some get burned out, while others work for temporary staffing agencies.
It's so lucrative for a nurse to travel today that they can pick up and leave here and go travel someplace else.
That's because travel nurses can make a lot more money. Sparrow Hospital President Alan Verling says it paid $25 million for travel nurses last year. That's $20 million more than what the hospital paid in 2019, forcing Verling to tighten his belt.
So, do you spend as much money on capital? Probably not. Do you look towards expansion as rapidly as you would in some areas? Probably not. The impact, the patient rarely would see it.
It's not just Sparrow. McLaren and Henry Ford are also having to pay significantly more to staff hospitals.
We hear reports of nurse staffing wages more than $100 an hour, $150 an hour. We are competing with other areas of the country that report $200 an hour and beyond.
Laura Apple is the Senior Vice President of Health Policy and Innovation at the Michigan Health and Hospital Association. She acknowledges the latest COVID surge created a stronger demand as healthcare workers also got sick. But Apple is worried these staffing agencies are taking advantage of the nursing shortage during a pandemic.
We were part of an effort by the American Hospital Association to send a letter from our members of Congress to the White House Coronavirus Task Force, asking them to look into the practices of staffing agencies.
200 members of Congress signed that bipartisan letter, including Representatives Alyssa Slotkin and Tim Walberg. The letter claims staffing agencies are making a larger profit since the need for temporary nurses is up across the country. But the American Staffing Association, which represents many of the traveling nurse agencies, says that's not the case. The association's Vice President of Government Affairs, Toby Marla, says the prices are up because of supply and demand.
We've watched the demand for nurses rise, the supply drop, and temporary nurses are demanding higher wages to go work in these situations, literally putting their lives on the line.
Marla says 75% of the cost hospitals pay for traveling nurses is what it costs the agencies to employ that nurse. So it includes things like housing, taxes, and the nurse's salary. The company keeps 25% for profit, which stayed the same throughout the pandemic. Marla says these agencies are having to pay nurses more because they are short, just like other hospitals.
We were hit with Omicron, and we were hit right around the holidays with it. And all of a sudden now everybody had to ramp back up.
Marla says the money isn't the only reason he's seeing people choose to be a traveling nurse.
Through a staffing agency, either as a per diem nurse or as a traveler, because they were able to control their schedule, they were able to take breaks when they needed to recharge.
It's not all bad news. Sparrow says traveling nurses are also a way to recruit and fill some of the long-term voids.
We've had nurses come in here and take full-time jobs to be a Sparrow nurse because of the people they work with and the people they were working for, and because of the opportunity to live in mid-Michigan.
And like Lydia Mobley, who got into nursing to help others, says the past 2 years have been tough on nurses, but she's grateful to be there for her patients and the time they need her most.
I really want to help. I feel like my neighbors, my Michigan neighbors, that's who I want to help the most.
I asked Attorney General Dana Nessel's office if they are investigating price gouging by any temporary nurse staffing agency in the state. A spokeswoman tells me they are aware of the concerns, but there is not an active investigation on the state level right now. Jonesville's police chief is thinking outside the box to try to fit openings. That's why he's considering shifting officers to 48-hour shifts.
Now you've got departments throwing money at officers just to get them to come to see them. A neighboring department had a $5,000 signing bonus, had nobody apply.
Jonesville Police Chief Kirk Etter is trying to find 2 new officers to patrol the small town in Hillsdale County. It's a trend many similar communities are seeing. Williamston Chief Jim Wolf is having a hard time finding just 1 officer.
When you're going against state police or FBI or ATF, DEA, I mean, they're all pulling from this same little applicant pool. So it makes it hard for the smaller PDs.
That's why Jonesville is looking to 48-hour shifts, something no other police department in Michigan is doing.
But I can work my schedule to accommodate them and give them the benefit of doing more family-style activities or more vacations.
It would also mean 24-hour coverage in town, which isn't happening right now. Many people in town tell me they like the idea of having local officers available around the clock.
I mean, obviously we need somebody to protect us. So if there's a shortage right now, I think it's a great idea.
Etter is modeling these shifts after a police department in Washington state, and he thinks it will catch on.
This schedule, I think, is going to be the new wave of the future because it's worked for firefighters, it's worked for ambulance crews. 48-hour shift isn't nothing, or 72-hour shift for them.
Police chief says it appears to be working because he's getting more and more applications since the idea of going to the 48-hour shifts was brought up.